there were no options. Surgery was the only way of trying to get back what I had, because I had lost everything.
His first question is, will I play again? It's a heavy-duty one. But I felt sure that that was certainly going to be true. I think the thing that was great about his recovery was that he began to realize somewhere in the middle of this that it was going to work.
I saw Mr. Dichter for his Dupuytrens Contracture of his small finger. But generally speaking, most patients who have Dupuytrens disease have it either in their ring finger or their small finger, and so that's where most of our efforts are centered. And I'll just illustrate on my hand what a typical patient would be like, and that would be a contracture of both the MP and the IP joints. It's called Dupuytrens disease. It is a condition in which the normal fibrous architecture of the hand begins to contract, and certain fingers are affected more than others. It begins in a sort of a nodular phase, and then it proliferates, and then the nodules sort of join hands, if you will, and the fingers slowly and insidiously contract down. And sometimes people don't notice it until they're really impaired in a normal daily task, maybe buttoning a button or putting their hand into a pocket, at which point they feel their hand and feel this sort of thickened cord. Anyone can have Dupuytrens disease, but generally speaking, men have Dupuytrens more than women. Generally, third and fourth decades is the earliest you'd see it, more common, sort of fifth and sixth decades of life. And then there's geographic variation. We see both genetic and geographic variation of the disease. Northern European people, Scandinavians, Ireland, and interestingly, Australia. Rarely in Asian, less commonly in African Americans, but a distinct genetic predominance. The risk of loss of a digital nerve or a vessel can be catastrophic to anyone, but peculiar to an elite athlete or a virtuoso pianist is their particular demand.
If you use your hands, and your hands have been part of your creative life, to see them less than 100%, you'll know the pain as soon as you start to experience it, and you have to deal with it soon, and you can get it back. So if there's any suspicion that your hands are not functioning as you would want, there really is no reason not to seek out the best possible hand surgeon in your area, and seek out two, seek out three, get their opinions, and then find the one that you think you feel comfortable with, and then totally entrust yourself to that person. And if I stop playing tomorrow, I've had an extra year and a half of joy